Welcome back. We have a guest who's been on our show before. I don't know, maybe a couple months ago,
Yeah.
if I'm not mistaken.
Yeah.
I think it was. Welcome back,
Thank
Dr.
you.
Nimmi Kapoor. Did
That's
I
it. You
pronounce that
got
right?
it.
And you are a breast and thyroid surgical oncologist with BreastLink.
That's right.
So great to have you back. You wanted to talk about genomics, which cancer genomics, and I hear that. I think it's genetic testing. Am I
hmm
right?
In part, yeah. So
Okay.
genomics is really an exciting field of breast cancer. It's basically the study of genes and how they function. When it comes to cancer genomics, we're really trying to understand the biology behind cancers. Not only who's at risk of getting cancer, but what kind of cancers are more aggressive so we
Mm-hmm.
can target them and treat them appropriately.
That's really interesting, in that
hmm
as more and more research goes on, do you find, since you're obviously know this field very well, do you find that are cancers more genetic? Are they more environmental? Are they a
hmm
mix? Are we predispose someone within their genes to be more at risk
Yeah.
for cancer, like we are in other things? Some people are more at risk in certain diseases, just they're born that way
Yeah.
compared to others.
So I think of genetics in a few different forms.
Uh-huh.
One is at the individual level. Can we test for genes in the person to see if they're at risk for developing cancer?
Mm-hmm.
So especially for our Laguna Woods community, patients who have had cancer when they were much younger, but now their family's asking, well, mom or dad, am I at risk for having the same kind of
Right, right.
cancer? We can actually do genetic testing on them.
Mm-hmm.
Maybe it wasn't offered back then, but as each year goes by, we know more and more about genetic testing, so we can test people now to see if they carry a gene mutation related to breast cancer. That only corresponds to about 20 to 25% of all breast cancers, maybe even less.
Mm-hmm.
What's really fascinating, though, is the tumor genetics. So that was cancer genetics in the person, what we inherit from mom and dad.
Mm-hmm.
We can actually look at the genes within a cancer, and then we can even look at the genes within a single cell.
Mm-hmm.
So that's the part of the field in biology that's really exciting to me.
Yeah, I find that not only exciting, but in the long run, very, very beneficial, to the
Right,
point that
right.
maybe there are certain kinds of vaccines that will be developed in the future. And I know there are so many different kinds of variables in cancer that one vaccine is not going to do it all, but it's great. And
It's interesting you brought that up. I mean, vaccines are definitely a big field of interest, and they're trying to figure out, especially with certain types of cancers, they're called HER2 positive cancers,
mhm.
if we can develop a vaccine for patients to prevent that kind of cancer from coming back. And it seems to be working. So this is a huge interest that we have.
Is that what we hear about the cervical cancer? That vaccine is often given to
Absolutely.
young girls? Okay.
Yes, the HPV vaccine.
Yeah.
Yes.
Good. Who's a candidate for genetic testing? Are you going to be done on anyone?
Well, we do have national guidelines, and that helps insurance companies figure out
Right.
when they should pay for it. Anyone can actually technically pay for the genetic
Mm-hmm.
testing, but typically we want to test people who have had cancer before the age of 45, especially in breast cancer. Women who've had ovarian cancer, we want to test everybody. Certain types of
Okay.
cancers are really important to test for, triple negative breast cancers we talk
Mm-hmm.
about, as well as patients who come from certain ethnicities, like Ashkenazi Jewish families. We want to really look carefully to see if they have any mutation related to breast cancer.
Interesting. Uh, as far as determining the risk, when you're doing that testing,
Mm-hmm.
how accurate it in that we've heard about women taking, if you want to say, very extreme precautions
Sure.
by having mastectomies done and things like that. Angelina Jolie, I
Mm-hmm.
think, because
Exactly.
they see that pattern in their family, and they're just
Mm-hmm.
like, we don't want to deal with it.
So it sounds radical for some
Yeah.
people, but for her, and for example, watching your family member, your mom, die from an ovarian cancer
Mhm.
ultimately is serious.
Right.
This is not small peanuts we're talking about.
Yeah,
It's a very
yeah.
big deal. So the risk, if you carry one of these genetic mutations, is as high as 87% for some women for
Wow.
developing breast cancer, 44% for developing ovarian cancer. So there's real risks, and that's the point of testing, to see what can we do to prevent that. You don't have to do the radical things, that the big surgeries that are described with Angelina, but you could do other prevention. You can take oral contraceptives to lower the risk of ovarian cancer. You can take tamoxifen to lower the risk of breast cancer.
Mm-hmm.
So it's important information that we can act on. And that's why I think, the key here is knowledge is power, right?
Right.
So the more information you get, the more we can learn from it. We learn more about what to do with a cancer and how to treat it, prevent it, and then basically more targeted treatment. So we don't have to give these big chemotherapies.
What is it that you do to get the genetic testing started? Is it a blood test, a swab,
Right.
swab test?
It's a good question. Some people are scared, like, oh my gosh, what do they have to do to me, right? It's not that big a deal. When we look at the person, we're looking at the genes that they're inherited. It's simple blood test or a saliva test even. So
Okay.
don't even need a needle sometimes. When we look at the cancer and the genomics of the cancer itself, we take the sample that's already been taken. So we take a piece of the tissue that's already been removed
Mm-hmm.
and look at that under a
Okay.
microscope.
What are circulating tumor cells? It
Aha.
sounds like cells that are really going around the body and landing in certain areas.
Right. So I think this is really fascinating field. About 5 years ago, it was really mainly just in research. Now it's hitting prime time. In the clinics, we're looking at this. So you can have a cancer in the breast, for example, a tumor in the breast, but we know that it has the ability to spread.
Mm-hmm.
So we can actually check the blood to see if there's cancer cells from that breast in the blood. And a lot of the times we will find that there's circulating tumor cells or cancer cells from the breast or another cancer we can find in the blood. And it's really, I think it's those cancer cells that are going to be important for the person. Those are what's going to cause a patient to possibly die from the cancer, not what's going on in the breast, but what's been able to escape the breast.
Mm-hmm.
And I think, at BreastLink, we're really at the forefront of trying to get on top and ahead of what's happening in cancer biology and genomics.
Yeah, I find that very, very interesting that
Mm-hmm.
you're able to do that and in the long run maybe prevent something
Yeah,
that could occur.
what I think is even more specific, though, this is very brand new. There is one company that's looking at the cancer cells in the blood, but looking at the individual mutations in the blood, in the cancer cell. So they can take one population of cancer cells and say, well, does it have a mutation for PI3 kinase? Then we can give this drug that we use for a different cancer for it.
Right.
So we're finding that drugs we already have available for different cancers might work for the breast cancer that we didn't think of.
And is this one of the things you can do to prevent the cancer from reoccurring?
Potentially. I think that's where we're going, and we need to figure that out. I would love to say that we can find a simple blood test and say, okay, this is there, we give you this, and you don't get cancer.
Yeah.
That's where we need to go.
Very good.
Yeah.
Well, you're having a seminar coming up, a talk?
That's
am I right?
right,
And when will that happen?
I think it's October 9th on Thursday, so we are talking about cancer genomics, breast cancer, especially high-risk things, breast density, prevention especially is a very important thing that I want to, each of my cancer patients that I meet, I go over some key factors about what you can do to lower your risk of cancer coming back. And so that's a really important concept that every cancer patient should be aware of. This whole aspect of genomics and molecular testing in cancer is really coming up more and more.
Yeah.
There's so many companies coming up with offering different tests, so I'm trying to help people kind of navigate what's the right test for them, what makes sense, but also it's important to really make sure patients are trying to help us with research.
Well, thank you for coming on.
Okay.
Fascinating. I know we'll see you again.
Okay,
and
great.
It's really very interesting, and it's nice to see that slowly but surely things are progressing.
Yeah,
So
we're all very
it's great.
excited about it.
Thank you, Doctor, for coming on.
Thank
We'll
you,
be right
my
back.
pleasure.